I went to apply for a job at a rental car company, and it just so happened she was a manager.
We worked together approximately 7 years. After the car rental, I got the job with Humana. We haven't seen each other since almost 15 years now.
I was new to Medicare, Medicaid, all this literature that I was getting, phone calls, emails, snail mail. It's sort of confusing. I don't know which route to take, what company to choose. But when I talked to our mutual friend, and she says, well, you remember Pat? Well, Pat is an agent. I says, this is a no-brainer. Signing up, the process was much simpler than I thought. I felt like at ease. She was such a friend, such an angel. It was almost like motherly care.
He hadn't had any checkups or physicals. He hadn't had any screenings done. I wanted to make it easy for him, so I met him at the Centerwell office. I let him know, you don't even have to go anywhere to get your blood work done. All of that is right here. I knew that that would be beneficial for him.
Here at Centerwell, we see about 10 patients a day, sometimes even less. When a new patient comes in, you have the opportunity to really get to know them. Centerwell is so different in that they do want us to provide quality versus quantity care. Sometimes we'll have patients come in that haven't been to a doctor in several years. That extra time helps me find out what they are currently dealing with physically and emotionally. I want to make sure they leave here knowing exactly why we do everything that we do.
Marisol was very, very nice, very easy, very simple. Just to pull up at a parking place right in front of the door is a humongous plus. On a scale of 0 to 10, Pat is a 15. If in need, I can always call Pat. And the times that I've called her, she has come through. I was asking her, is my dentist in your book? Can I set up an appointment? Same thing with the eye doctor. I haven't been to an eye doctor in a while, so that's on my to-do list. I feel 100% positive that Humana, as well as Pat, will meet my needs. And hopefully I won't need them, but I know they're there if I do need them.
The one thing that I really learned over the years was our part about human care. A lot of people that are alone, they don't have any help. Some people just want to sit and talk. It's just so heartfelt, you know, to really want to make sure that people are okay, especially our senior population. It's about taking care of that person. He depends on me, and I want to be there to provide the human care that we provide.
That's you a comforting soul.
Thanks, God.